Good day, everyone. Today's article is titled CBCT Assessed Outcomes and Prognostic Factors of Primary Endodontic Treatment and Retreatment, a Systematic Review and Meta-Analysis. It was done by Martins and colleagues and was published recently in JOE in June 2025. Periapic radiographs have limitations in evaluating endodontic treatment outcomes, which CBCT can address by providing a three-dimensional view. This review specifically focused on how CBCT assesses periapical healing, overall success, and identifies factors influencing these outcomes in teeth with apical periodontitis. So, a systematic literature search was conducted up to March 2024. Studies on human permanent teeth with apical periodontitis undergoing primary root canal treatment or non-surgical retreatment were included, provided they had at least 12 months of follow-up and used CBCT for both preoperative and follow-up assessment. Also, the overall periapical healing and/or success rate of primary root canal treatment or non-surgical retreatment is given, or it could be calculated from the raw data provided. And they excluded studies on primary dentition or teeth underwent endodontic microsurgery. So this meta-analysis included 19 studies comprising 1,695 teeth and 1,105 roots. Follow-up period ranged from 10 to 67 months, and recall rate ranged from 63 to 100%. Most studies focused on primary treatments, which were 13 studies, and 7 on retreatment, and 2 involved both. As for the periapical healing rate, using Lucey criteria, which is achieving complete or incomplete healing or reduction in lesion size, the pooled periapical healing rate was 87% for teeth and 84% for roots. And using strict criteria, which is achieving complete healing and normal PDL space, the rates dropped significantly to 36% for teeth and 44% for roots. The success rate with Lucey criteria, the weighted pooled success rate was 85%, and with strict criteria, this rate was 45%. As for the outcome predictors, meta-regression identified several factors influencing outcomes, included number of visits, irrigant type, tooth type, operator experience, apical preparation size and taper, and obturation technique, where they found that treatment performed over multiple visits were associated with higher periapical healing and success rate under strict criteria. However, this finding might be subjected to potential bias because it depends on the type of treatment and treatment complexity. And also, they found that multi-rooted teeth had a higher failure rate, and master apical preparation size of 30 is associated with better healing outcome. And finally, they found that lateral compaction yield better outcomes than warm vertical compaction under Lucey criteria for both success and periapical healing. This finding contradicts other previous studies which they had different results. At the end, the authors addressed the limitations of the included studies and the review itself, where many studies had a higher risk of bias, particularly concerning blinding and outcome assessment. The heterogeneity among studies regarding patient population, treatment protocols, and follow-up periods made direct comparison challenging. The reliance on retrospective studies and variations in CBCT protocols, such as voxel size, were also acknowledged as limitations. And in conclusion, CBCT reveals significantly lower success rate when strict healing criteria are applied compared to Lucey criteria. While CBCT offers enhanced diagnostic accuracy, its routine use for evaluating treatment outcomes may not be essential, as it yields similar results to periapical radiographs under Lucey criteria. And thank you.